The statistically significant conclusions that came out of the multivariate analysis were that those patients with splenic or extranodal disease tended to fare a little worse with the BTKs. Perhaps surprisingly or perhaps not surprisingly, one of the interesting findings was that those patients who received a BTK in the frontline setting not only had a higher response rate, but actually had lower toxicity. And with what we've seen here at today's meeting, the data from Michael Wong and colleagues discussing the role of bendamustine, Ibrutinib, rituximab in the frontline setting, I think it does provide a little more ammunition for thinking about BTKs not as a first salvage agent, but perhaps as a frontline agent. And so there are really interesting data, looking at Ibrutinib and rituximab in the frontline setting, really interesting data being generated also by BeiGene, who was the sponsor for this data set we're discussing, looking at Zanubrutinib versus Bendamustine in the frontline setting. And I think what we're going to see more and more is this pivot, as we've seen in CLL, away from chemotherapy-based regimens to chemotherapy-free regimens. And whether that's a Revlimid rituximab approach or a BTK with or without Rituxan approach, it's very exciting. Of course, we still have venetoclax and incredible data being generated there, again, in newly diagnosed patients. And so we're going to start to, I think we're going to start to see mantle cell lymphoma evolve along a similar paradigm as CLL has. And I'm really excited about that. It'll be, indeed, with what we've shown already, less toxicity and great responses and ideally preserved responses over time.